Welcome to the Health Tech Edge, the podcast on how technology is reshaping healthcare operations. I'm Mike Moore. Today, I'm joined by Victor Hunt, co-founder and CEO of Zingage. Zingage is an applied AI company operating inside non-medical home care, supporting 400 plus home care agencies and more than 50,000 caregivers. And what makes this interesting is they're not running pilots. This is live coordination work 24/7, where operational failures have immediate real-world consequences. This episode is about AI in home care not just as a buzzword, but as a reliability and logistics problem. Because when staffing breaks or documentation fails, patients don't get care. Victor, welcome to the show.
Thanks for having me, Mike. Super excited to chat.
Yeah, that's great. And so I think what would be helpful for a lot of people before we get into the AI is just talking about the current situation in home care. Kind of, if you can give us an idea of the landscape, like what's happening. Is this really the front line of healthcare right now as you see it?
Absolutely. I mean, if you look at the big tagline today, everybody thinks about population decline and all of the shifts in demographics, 11,000 seniors coming online every day, and just the total landscape of how people are expecting to receive care is evolving. The consumer psychology is, I want things brought to me, not I want to go and get services. And so that is true in so many parts of life today, from food services to transportation, but it's not as true as we need it to be for healthcare. And so what we're seeing is both a rising need from folks who are living at home alone. Their health is worsening, their access is decreased, and the cost to sustain their health is increasing versus the consumer demand to also receive care in a place that we love the most, our homes. And so that's, the driving factor in what is promoting so much of this need. And on the other side of this is, as a category of healthcare, this is such a highly coveted space that you see piles and piles of wait lists, people who can't get the care they need in the home, whether it be Medicaid wait lists or even private insured based home care providers turning away patients and clients because they simply don't have the capacity to even process those intakes, to process these new folks who are coming through the door. So the swelling is just getting bigger and bigger. And that's why we're here to solve the logistical burden so that more folks can go through the door and get that care.
So let's talk about that logistical burden. Kind of what happens? Like when does home care delivery tend to break, or what kind of happens and when it breaks first? I guess.
Yeah, sure. I mean, when you look at some of the most simple things like phone calls, can you call your provider today to understand what does care look like if I want something for my grandmother who is diabetic neuropathy, needs care to make sure that she's keeping up with her routine and her diet so that she can avoid those hospitalizations that are so much more costly, so much more burdensome to not just the families and the patients involved, but also the payers who have to pay for those ambulances, have to pay for those visits. And so, can we even get this kind of information so that we can understand the options for care? When we look at our customers before they're using Zengage, the volume of calls that they're receiving is inordinate. It's continuing to grow. And then you're looking at a frontline who is also reaching out to get guidance, whether it be on schedules, care plans, emergencies. And so all of this is combining into the sort of swelling work that the administrators have to deal with. And so they're missing 20, 30% of calls at a time. Those calls are having to be manually processed and decided on what to prioritize. And then going downstream from this is a massive amount of data entry work and care coordination, from understanding who is the best fit caregiver to replace this person who called out. What should we do with this new information that we receive from a patient who's been discharged, adding it to their care plan. And so you've got all of these competing priorities swelling in the hands of this back office who has to process and play the trolley problem on steroids between what they decide to work on versus put off for the moment they get some air.
So now we wave the magic wand. Now they're using Zengage and partnering with you and the team. What does life look like now in terms of, those were the problems that you kind of described. How does life get better when they're using Zengage?
Yeah, it sort of starts, there's three phases to this evolution for those folks who start using Zengage. First stage is sort of the growing pains of getting used to sharing that tacit knowledge. We've done things a certain way as an agency, as a provider for years, and that information isn't written down somewhere. it's often locked in people's heads. It's often very dynamic. So it changes based on things that we haven't quite been able to articulate, whether it's different regulation, whether it's seasonal, right? Holidays have more call outs, and here's how we as an agency, as a provider, handle them differently. And that might just be tacit knowledge that's passed on that just lives in folks' heads. And so that first stage is kind of learning how to interact with the AI so that you can have these conversations and teach it because it is very capable. However, it's only going to do the sort of things the way you want if it has that knowledge. Otherwise, it's going to come up with really creative and interesting ways to do things, but it may do the right thing in practice. However, in the sort of intent behind what you're going for, whether it's I need to write my EMR notes in a way so that Medicaid is understanding it the way that we communicate to them versus how the AI is just simply reporting. So these sort of things are phase one. That's usually a pretty exciting phase for people because they're getting into the feedback loop. They're teaching the system, and they're seeing just how much they can improve as well in terms of their own process. So it's very much a dialogue. Phase two is now that the dust has settled, we're seeing the AI take action. We're able to start to add on new ideas that we previously didn't have the bandwidth for. So, for example, we might have a caregiver staffed to a new patient. That person is being introduced by the case manager at the onset. And from that moment on, this interaction is hands off, except for the situations where maybe the patient has new information that has to be passed back into the system, or care plan has to be updated, medications updated, maybe an emergency happens or a call happens. But for the most part, it's pretty hands off. What we would love to do if you're a provider who had unlimited capacity is do follow-up check-ins, patient engagement. Hey, how's it going? How's it been with taking care of this person? Is the mileage still good for you? How do these hours work? Is there information that we might need to pass back to the referral partner so that we can actually increase their authorized hours because maybe they need that? Most of this work doesn't get addressed because they're so backed up on the reactive work. But now Zingage gives them the capacity not only to execute those ideas, but to automate the execution of those ideas. And then phase three is where it gets really interesting because then we start to come up with new ways to enrich the patient and caregiver experience. So we're going beyond the scope of what we thought was possible, where we're starting to say, well, how can we take this data and illustrate the improved access, improved outcomes that then show our payers, whether it be veteran affairs, whether it be long-term care insurance, to say, actually, this preventative care is making a huge difference because what you're paying in the hundreds of dollars of preventative home-based care, you are saving against the rehospitalizations that show up as tens of thousands of dollars in higher acuity needs. And so this is where we see the future going, is that we can take folks out of the firefighting of healthcare in the home and put them in the forefront of telling that story to say, this is actually the best way to receive care. And the payers, by understanding that, will push much more into this ecosystem.
Yeah, I like what you describe in kind of the phases because I think for most organizations, in terms of any AI adoption, that especially something that sounds like it's going to have some big impact on the organization, needs to be progressively done. It can't just be like today we cut over and all of a sudden life is 100% run by AI, right? There's still the human side of the team, and I think a lot of what and we've had previous guests on the podcast talk about the human readiness, right? We wouldn't test a piece of software in production, right, and kind of roll it out without doing some sort of testing and user training, those kind of things. Yet we do that with humans all the time. We put them into situations that they're unprepared for. So having a phased approach to the implementation, I'm sure you're getting feedback from your customers that gives them a way to ease into the adoption and understand how they can evolve the work that they're doing and build trust, quite frankly, that the software is going to help support them in what they're trying to do in delivering excellent home care to their patients, right?
That's exactly right. There is a symbiotic relationship that everyone is frankly still figuring out. This AI paradigm shift is so new. Obviously, as someone on the forefront of being able to use this both in providing value, but to also use it in my own work every single day, we're learning new ways to augment how we do things. And I think the paranoia a lot of folks have is displacement. Is this going to replace what we need, what we do? Does AI belong in this point of interaction? And frankly, there's just so much, especially in what we're doing in healthcare, there's so much room and work to be done that it is just unfathomable that we even have that concern of displacement because there's still so much more that we can and should be doing, but simply can't get to because of the grunt work that it takes to do the basics and to react to our requirements.
Yeah, I think that's an excellent point because there's so much to be done and people want to do better, right? Like they don't do this because they show up at work every day and want to be mediocre, right? People want to provide an excellent service to customers, whether that's the people who are showing up at the office or people who are actually getting into their cars and doing the home care visits. Everyone wants to do a good job. That's why they're in the business. That's why they're providing the service that they're providing. Yet we don't set them up for success with a lot of the tools and systems that are in place today. There's a huge opportunity, I think, to modernize and really accelerate the AI adoption as you and the team are working on so that they can focus on the things they want, which is, I don't want to have to deal with scheduling as much as I do. I want to be able to enjoy my nights and weekends, maybe if I'm on the administrative side in the back office. If I'm the person who's driving out and seeing patients, I want to be able to focus on delivering care and providing a great experience to them and helping my patients be successful and get what they need, not on kind of the documentation reporting, all the kind of the burnout, with scheduling and kind of getting last calls and late calls and those kind of things. So I think that there's ultimately you got to be the patient impact too, right? Like patients just want it to be seamless. I know, from having some loved ones who have been in a situation where they believe that they have home care scheduled, they're expecting people don't show up or show up a different day than what they expected. Just all the confusion around that coordination and the scheduling is got to be probably a number one use case that you're solving for.
Absolutely. That's certainly the most acute pain point is the coordination around delivery of care. We serve hundreds of home care agencies around the country, and collectively they do around 50 million hours of care per year. And so when we look at the data from this cohort, what we see is that on average, folks before getting started with Zingage are seeing about 11% average call out rates. And so that means 1 out of 10 visits will experience a caregiver who is either saying they cannot make it to the shift or is simply not showing up, and you find out minutes into when the visit is supposed to happen. Now, typically when that happens, this is where the stress really explodes for these folks because they're scrambling to reallocate staff that is already extremely limited to try to figure out how to place people on very tight margins to begin with. And so they're already putting out fires in other areas, and you can't predict these things. You can't anticipate the call out's going to happen, exactly at 8:15. There are times where, we have so much data now where we can start to understand demand cycles and surge. So we have a good sense of roughly the heat map of this problem. That being said, to be able to address it, the bandwidth it takes normally is so overwhelming that folks are having to pick and choose their battles. And the unfortunate thing is that from a patient or consumer side, you think that this provider just doesn't care about you, that they're just a crappy provider. They aren't taking care of their patients because they're letting caregivers or nurses call out and not show up. But if you've been in this business long enough, you know that's not the case. This is the situation across the board that folks are so capacity constrained, so supply constrained, that it really eats into what they're able to do from a reactive perspective. So Zingage obviously takes all of that work off their plate. More importantly, we do this in a way that allows them to create more leverage. So how do we reward the people who are showing up so that they're not just going and doing the basic needs, but we're reinforcing the folks who are going above and beyond. And that's where Zingage actually started, is through this sort of incentives to drive that engagement and to drive that sort of stepping up to the need. But our goal is that over time, by solving the logistical burden, by telling that story of, this is the better place to deploy those Medicaid, Medicare dollars, that the actual reimbursements for this work will lead to a surge in supply because we'll be able to actually attract more people to work in this space and more folks to do the kind of work that's needed here.
Yeah, I think that would help from a recruiting and retention perspective, right? Is that, we're an employer that believes in, efficiency and using modern technology to manage and right. And like, if you are someone who's worked in home care in whatever capacity for any amount of time, you're going to know what good companies look like and bad companies look like. And so if you're able to work for one that uses the latest technology to reduce the back and forth on scheduling to give you, for those who maybe want to pick up more hours or more visits, has the capacity to kind of easily see what's available and be able to pick up more for those who are really trying to drive more, financial results for themselves, right? It just, everybody wins by having some tools that are purpose built really for this space. So I'll use that as kind of a pivot to ask you, among all the problems that you could have tackled in the world, whether it's healthcare related or otherwise, why did you choose to focus on this company in this space with Zengage?
Yeah, sure. I mean, there are so many reasons that I care about healthcare and I care about the work we do. Just as a bit of backstory, this is my second company. So I started my career building property technologies, prop tech, bring building managers, hire contractors more efficiently. It was a marketplace that I started in college at Yale, 2017, which I scaled to 30 cities, and ended up exiting that company in early 2022 and learned so much in that space and took time to go back to the drawing board to ask what I wanted to do next and what I care about. And healthcare was top of mind all the way. Growing up, my grandmother was a career nurse. She worked 30 years at Jamaica Hospital. I saw firsthand how stressful that was for her working those night shifts. And she eventually went on to start her own home care business. And so eventually that stress migrated from the clinical workload that she absolutely loved to the operational workload, which was a very different kind of stress that she didn't quite love as much because she wanted to deliver care at scale, not have to get stuck in the logistical burden of this. So that was always a very relevant point in my mind. But on a even sort of more a kind of personal note than that was my mother, who experienced traumatic brain injury through domestic violence. And had it not been for the caregivers, the home care that we were able to receive in a single parent household, my siblings and I would not have been able to grow up with her and preserve our family together in those adolescent years for me. And so having that sort of experience gave me such a deep appreciation for what home care means and can be for this world. And just looking at, the bigger picture, our vision is that you can get care anywhere, anytime, and at the extent that you need without having to go through extra steps to access this level of care. We believe that everything from basic companionship to hospital at home should be the norm for healthcare as opposed to this kind of offshoot of a specialty care. So that's our vision here. And my inspiration is my family all the way.
Yeah, I mean, regarding your mother specifically, a terrible circumstance to bring you and your family close to home care services that, ends up having this kind of profound impact on you. So my thoughts are with you and your family for that. But unfortunately, that's, I think, a lot of the healthcare stories that I hear from founders, something deeply personal connects them to the mission and kind of the work that they're doing. And it's kind of the good news, bad news of the industry is, right. Like, there are so many problems to be solved that the talented people like yourself, entrepreneurs who are willing to go and figure it out, right, and kind of put an engineering mindset on how can we make this problem. Like, if people aren't willing to take on these challenges in this healthcare system, things will never change. So I admire you and your team for the work that you're doing and kind of picking it up. And it doesn't help that your grandmother, provides some inspiration and kind of the work, and you can see the day to day and the work that she put in as a healthcare worker and working in this space later on to understand what some of those issues are and kind of how specifically might you go after helping with some of those issues. So a ton of admiration for the work that you and the team are doing. When you get this out into production, there's kind of the building that and certainly having your grandmother and kind of the insights and the coaching, from that space. What surprised you once you put this out into the world, right? We build products, we think we know how people are going to use them, and then sometimes we put them in the hands of customers and they surprise us with what they do. So anything kind of that really surprised you and the team as you got it going?
Yeah, absolutely. I mean, the incredible amount of agency that our agents are able to imbue into these provider practices, it's been remarkable and scary at times. And it's really put us in a position to say we have to be super close with our customers to define the sort of rules that are true to their business and different across the board. And so what I mean by that is, an agent that is responsible for care coordination should prioritize safety and care beyond anything else. And you would imagine that in this paradigm, this is a very straightforward, sort of common sense way to define what is safety. However, for our customers, safety can mean all sorts of things. doesn't just necessarily mean making sure that the patient is receiving care at the time that they're supposed to, but also it could mean for a specific population, if it's dementia patients who are calling in to check on schedules and looking for a conversation, to be clear on the sorts of signals that can tell us who this is that's calling and not disturb the sort of ecosystem that this agency has created in terms of how we communicate back to that patient, what we action on versus just and so there's all of these sort of levers in terms of defining that context that guides the AI, because it can be quite dangerous for anyone to put AI on the front line of healthcare, and to take these sorts of actions without that level of clarity and context that is often not written down anywhere, but simply tracked in people's heads. Times it's written down, but in ways that are really hard to discern. For example, you have things like the dementia GEMS ratings or GEMS scores, there's diamond, emerald, sapphire, etc. Listing that in an EMR as the signal to know this patient has dementia is, something that you would really have to be in and around the context of this industry to understand. Coming in and just throwing any random AI at that problem would lead to many different issues, such as someone canceling a visit on a snowstorm, but that person should always have 24/7 care. So these are the sort of things that have been really surprising from a just how deep this problem goes beyond a technical perspective and almost into sort of a governance/legal theory perspective. How do you craft rules that guide highly capable agents and technology to operate safely and define what safety means in those very nuanced customer by customer, location by location circumstances?
Yeah, I think what I'm hearing too, and you going back to your response about kind of the phased introduction of the solution, is that and you don't always see this in the software industry. Some people take, these kind of problems. I think Steve Jobs is famous, for making a statement about customers don't know what they want. He knows what they want and he was going to tell them, right? And they kind of take it the Apple way versus, you're kind of coming up front and saying like, we know a lot about how the industry works, but we also know a big part of that is that tribal knowledge that just lives in the heads of the people who do the work. And the model needs to be trained on how they operate specifically, and having kind of that respect for the way that they work, and understanding that different agencies may handle things in different ways to provide the care and treatment of their patients. So I think that's an important part, to not lose that human element as we apply AI, right? We want to support and enable and take kind of the administrative burden off of everyone involved in the process, but we can't do it at the risk of taking some of the human element and the human judgment decision making out of it as well, and the human assessment, right? Like of whatever the condition or might be. It's like let's make the other stuff go away, help people. We say a lot in this podcast, helping medical professionals operate at the top of their license, or helping people work on higher value tasks, right? We know there's administrative things we can take off their plate so they can focus more on the things that they need to really drive. So if a healthcare leader is kind of thinking about AI and home care specifically, what's the first question that they should ask before buying any kind of solution, based on the experiences that you've had in this space?
I would ask how they have dealt with this exact circumstance of handling the variance in context. How do they actually integrate well, not just with the systems and the technology you currently use, but specifically the policy that your team adheres to? It's similar to thinking about this as hiring a person. So how does this person integrate within the team dynamics and the circumstances of managing a care population or care census without introducing all sorts of risks or sort of going rogue? And so that's where I would start. And to help agencies, we're actually very happy to have these sort of conversations outside of the context of what we offer, but to help share how we think about what providers should ask to protect themselves from introducing AI that can be quite disruptive to what they are doing day to day.
Yeah, I think, there's certainly the notion of having standard operating procedures and processes that we follow, and then knowing when and what an exception looks like and how we operate in that regard. And so I think the big takeaway here is just understanding that there is no one size fits all, There's certainly a lot of things that are in common from agency to agency and how they might work and deliver care, but having that personalization layer in the way that the AI executes and kind of works on your behalf is a really important piece. Earlier, you referenced kind of the growth of the population that has a need for these home care services. I had a previous guest on the podcast, Dr. Darren Patman, who's a practicing doctor and also a tech founder, and he pointed out the issue around transitional care assistance. And right, there's just a population that statistically qualifies for this benefit after discharge from a hospital stay, but it's under 20%, I think was the statistic on the population that actually takes up that offer and executes on it. So if more of those people, and that's kind of his mission with his company, is to help make it easier and for physicians, especially primary care doctors who may not even know they had someone in the hospital and now they're out. And then if they don't catch them in that time period and provide these kind of services at home to keep them and kind of get them back on track, keep them well, they may end up back in the hospital before they even found out they were in the first time, right? And so that's, I think, maybe there's a collaboration there for the two of you and kind of the way that your companies work together, because I think that there is some synergy in how we help identify the people who are going home, provide them with the services that they need and do it in the most efficient way, prevent those future hospital stays. Spending money now prevents spending much more money later on if they are readmitted, right? So there's the whole kind of circle of life and care continuum kind of piece that all of us want to make people more comfortable, give them the services they need at home, prevent readmission, all these kind of challenges that we deal with. And the population for this is just growing and growing as we go.
Absolutely. And I think what is the most top of mind for us here is the fact that, first of all, we would love to work with anyone who is increasing access to care for patients and those who need it. And that starts with opening the capacity for those folks to actually receive this care when the connection is made. Because while there is this massive gap in those who are utilizing the authorized care that's provided for them, there is a similar gap in terms of those who have requested care, who are aware and are actually able to receive this from providers, just from the simple fact of, can I get on the phone with someone and complete a intake and a prior auth that gives me the approval to receive care, let alone when you do get to the other side of this, right? The folks who are being serviced, are they receiving stable care without the disruption of call outs and no shows? And so all of this is a continuum on increasing that bandwidth, increasing capacity, and pulling more into this ecosystem so that the funding is there and the incentives are there to drive up more access and drive up more capacity for these folks to receive this amazing service that is home care.
Yeah. Yeah. Well said. Well, this was great, Victor. I appreciate you coming on and helping ground us in kind of the reality of what's happening in home care. And also it's good to know that, AI is reaching many parts of healthcare. And this was one that wasn't on my radar yet. So it's great to hear about the work that you and the team are doing and kind of ensuring that reliability of the services and the delivery in the home, where it really makes a huge difference for patients and their families, right? A lot of them, as you say, they want to stay at home. They want to receive these kind of services, helping to streamline the processes around it, make it more efficient for them to both onboard with an agency, for the agency to run their operations and make sure that people are actually executing the visits that they're supposed to is really critical. So thank you so much for sharing your story of what you and the team are doing.
Absolutely. Thanks for having me.
Well, for everyone listening, thanks for joining us. If you found this episode useful, go ahead and subscribe to the Health Tech Edge wherever you listen to podcasts. And if you know someone working in the home care operations, care management, or healthcare technology space, please share this episode with them. I think they'd be interested to hear what Victor and the team are doing. So with that, we'll thank everybody for listening, and we will see you next time.